Thank you, Tracy, for introducing us and inviting us to present. We're going to be talking about our programs here at the Thurston County Jail. To start, we're going to provide a brief overview of some of OHRS's programs and then kind of get into what we provide here. Olympic Health and Recovery Services is a licensed behavioral health agency primarily serving Thurston and Mason counties, founded at the direction of the Thurston Mason Behavioral Health Administrative Services Organization Governing Board in 2018 to fulfill a need in the community through crisis, jail diversion, housing, and peer support programs. Our agency is led by a governing board comprised of 2 Thurston County Commissioners and 1 Mason County Commissioner. Our mission is to provide access to an effective, reliable safety net of behavioral health crisis and recovery support services throughout our region. Here we have some of Olympic Health and Recovery Services programs. We provide crisis services through 24/7 crisis hotline, mobile crisis teams for adults. We have law enforcement co-responder programs through the Olympia Police Department, Lacey Police Department, Shelton Police Department, Thurston County Sheriff's Office, and Mason County Sheriff's Office, as well as designated crisis responders. We provide programs through our jail diversion programs, such as our Thurston County Corrections Facility Reentry Program, the TCCF Peer Support Program, our jail mental health crisis programs for Thurston County and Mason County Jail, our Thurston County Chemical Dependency Program, the Law Enforcement Assisted Diversion Recovery Navigator programs for both Thurston and Mason County, our Mason County Opioid Response Program and Medication Assisted Treatment, as well as Reentry Program. We provide the Outpatient Competency Restoration Program, as well as forensic projects for assistance in transition for homelessness. And through our hospital diversion programs, we have the Western State Liaison Discharge Planner, our Peer Bridgers, the Homeless Outreach Stabilization and Transition Program, and our housing programs consist of the Housing and Recovery through Peer Service, Forensic Housing and Recovery through Peer Service, as well as the Community Behavioral Health Rental Assistance. Moving on, here we're going to be talking about our specific programs for the Thurston County Corrections Facility, which includes mental health and crisis, our reentry program, peer support services, and our chemical dependency program. Our mental health and crisis program, MHPs collaborate with our Thurston County classifications team regarding housing concerns, competency issues, mental health and behavior issues, safety threats such as suicidal ideation and homicidal ideation. They meet weekly with the classifications team to review individuals with mental health issues housed in the maximum security units, as well as in general population. And our MHPs also act as liaison between Western State Hospital and Thurston County regarding individuals going through the competency process. Essentially, our MHPs are kind of dealing with anybody who comes into custody that has some sort of mental health and or behavioral health concern. It's kind of unique in the sense that we work really closely with the classifications unit. So not only are we meeting with individuals who are self-referring or being referred to the jail, but we also work with classifications when they have concerns about an individual. And it's really nice that we have that weekly meeting, because in that time frame, our MHPs are able to notify our classifications team if they've met with anybody who's maybe presenting with some sort of concerning behavior that's specifically related to housing, as well as classifications letting us know whether or not they've encountered somebody who's come into custody that maybe isn't on our MHP's radar, to be able to let us know, hey, maybe you can check out this individual. We also are able to inform classifications regarding people who are going through the competency process. One of the reasons why that's important is because those that are determined to be not competent oftentimes are not eligible for disciplinary infraction, and we do see a lot of these individuals engaging in problematic or difficult behaviors. And so it's important to let classifications know, so that that way they can then talk to their deputies to let them know, hey, this person's going through competency, we've got mental health on them, we're kind of tracking them, so let's not continue to write up disciplinary infractions. Our mental health crisis team consists of 3 master's level mental health clinicians qualified as an MHP. They are available 7 days a week. They can be contacted via the KITE system, is an internal referral system through the jail, or referred by deputies, peer support, our CDP program, or reentry. The MHPs occasionally will receive outside referrals from concerned family. And then we also just kind of like to reiterate that these are voluntary services for inmates in custody. So some of the things to highlight for our MHP program, our crisis program, being available 7 days a week has been a huge benefit. I think being able to be here, especially through the weekend, because we all know that people come into custody at any point in time. With that being said, our MHPs are only here during the day. Our contract requires us to be available between the hours of 8 and 5 p.m. With that being said, our MHPs all carry crisis radio, so they can be contacted anywhere within the facility pretty quickly. Some of the outside referrals that we can receive, just so people are tracking, is, oftentimes a family member might call because they're concerned somebody just was picked up. They might tell us that, their loved one was experiencing a mental health crisis at the time of the arrest, or maybe they'll inform us that prior to the arrest, they were trying to get their loved one into a mental health facility. That information is really helpful for us because it can help us then flag that individual to follow up to assess some sort of safety concerns, kind of make sure that their needs are being met while they're here, and so that we can support them while they're in custody.
And having mental health on staff that many days a week has also been critical for assessing the jail population that maybe come in fresh off the street, a new arrest, and those individuals that we know that there's likely some significant mental health issues going on, and that those mental health issues likely resulted in the activities they were engaged in when they were arrested. And so coordinating our mental health staff with the prosecutor's office and trying to divert those people out of the system when we're able to, and perhaps just have a DCR come in and evaluate them, will just steers them away from the criminal justice system altogether in some of the cases. Mm-hmm. And we also have people who come in who are in crisis. Sometimes we have people who are actually arrested from psych beds in the community. And so having mental health available right away to see those people and evaluate them, and maybe say, people who we can't even book because they're in, their mental health they've decompensated so far, that having that professional assessment to be able to talk to the courts and get public defenders on board with getting the 1077 process, if that's the direction they're going to go, or like I said, just diverting them out of the system altogether.
Yeah, that's actually a really good point. Thank you for bringing that up, Lieutenant. Some of the services that our MHPs will provide are suicide risk assessments, brief interventions, crisis stabilization, kind of like what Lieutenant was just talking about, individual and group therapy, case management, referrals to the psych provider. That's one of the also really nice things about this facility, is that there are psych providers on site at least once or twice a week. And then we also have a virtual telehealth provider. We provide referrals to other programs as needed. Recommendations for competency evaluations. What that really means is, if our MHPs meet with somebody and we are having concerns that that person may have some competency issues, or not really tracking the significance of their charges, or their behavior is so extreme in a way that it would impede with their ability to assist in their defense, we will contact the attorneys and just let them know, hey, we've met with your client, there's some concerns, you may want to look into a 1077, and at that time it's when the attorneys will make the decision whether or not they want to move forward with filing for a 1077 competency order. And then we do the housing assessments like we kind of talked about with the classifications team, as well as program clearances. We'll talk a little bit more about that with our chemical dependency program, but what that means essentially is anybody who is maybe being considered for a program, if there's some sort of mental health history and there's concerns about their ability to participate in the program, the jail will notify us. We'll go and assess that person to make sure that their mental health symptoms aren't affecting their ability to participate. More about our peer support programs. Our peer support services consist of one certified peer counselor. They're available 5 days a week. They can also be contacted via the KITE system or referred by deputies, mental health, reentry, or the chemical dependency program. The one criteria for our peer support program is that clients must not actively be in crisis in order to receive services. If that's the case, usually our mental health professionals will meet with that individual, kind of work with them until we can get them stabilized. And then if we feel like peer support is something that would be beneficial, we'll then refer them back to our peer support. And then again, these are all voluntary services for the inmates. And some of those services that are provided are distraction materials. So that could be anywhere from coloring pages, word searches, crosswords, activity sheets that kind of help somebody pass the time while they're incarcerated. They provide one-on-one meetings. They provide support with difficulties associated with incarceration. They help create SMART goals geared towards recovery and preventing recidivism. And they provide information on community resources and recovery programs. And one thing to note, what I think is really nice, is that our peer support program works pretty closely with reentry in regards to when they meet with somebody and they're expressing, desire to learn about community resources, our peer can certainly help them with that. But if this individual is then talking about really wanting to make a plan to follow through with connecting with those resources, they want to get referrals to maybe some of those resources, that's when our peer support will typically then refer back to our reentry specialist to help them kind of get started with a release plan and start looking at what are some of the things that they'd like to get accomplished once they're out of custody. Our chemical dependency program consists of 2 licensed substance use disorder professionals, as well as 2 assigned program deputies. What I think is really awesome is that these program deputies are typically in this role for about 3 years, so they really get to know the program and the participants and how it operates. And they are basically standard with all of the services provided for CDP. So every group, there is at least one of the chemical dependency deputies present as well. Our SUDPs facilitate groups 4 days a week. The participants are court ordered through the Superior District or drug courts. It's a 26-week program that utilizes evidence-based curriculum. It's broken down into phases 1, 2, and 3. Typically, our phase 1 is the most intensive portion of our CDP program. Then there's phase 2, which is a step down, and then phase 3. I think one thing to note is that those that are participating in CDP through drug court typically will be in custody for phases 1 and 2, and then they'll be released back into the community through drug court for phase 3. And then all participants must complete the program clearance for those with mental health concerns and meet the medical necessity through ASAM criteria. Some of the services through the CDP program include individualized treatment planning, one-on-one meetings, weekly court reports. All of our CDP participants are concurrently enrolled in the WorkSource Prep program, which is really nice because that connects somebody directly to a case manager. So not only are they in custody working on identifying employment needs and goals, but once they're released into the community, then they can meet with that case manager on the outside to continue with that process, creating resumes, getting connected to jobs, and finding employment. And then for our drug court participants through CDP, they are also enrolled in the Northwest Resources Intensive Case Management Program to help get them connected to housing and case management, to help kind of guide them through the drug court program as well in the community. And I don't know, Lieutenant, if you have anything else you wanted to add.
I'll say that compared to years previous, the number of people coming into the chemical dependency program that are also dealing with mental health issues, that mental health has been a really critical part of making the CDP program continuing for it to be successful. They work closely when we have our staff meetings. Mental health is there. They can address some issues up front, whether it's maybe referring somebody for meds and getting them stable on some meds prior to starting the program. We were utilizing work release as a kind of a step down phase previously. So people would transition to work release during phase 2 and then on electronic home monitoring for phase 3. Our work release program remains closed. So at this point, anybody participating in the program has to have enough time to complete phase 1 and 2, and then oftentimes they may be released for phase 3 or be in custody for all 3 phases. And that transitional component is missing. So PrEP has become even more important to us at this point for maintaining that connection outside.
And next, we're going to talk about the reentry program. And since I have Kenna here, who's our reentry specialist, she's going to go ahead and take over.
Hi, everybody. All right. So our reentry program consists of one bachelor's level clinician, that's me. I'm available 5 days a week, and I can be contacted via the KITE system or referral by MHPs, peer support, CDP. Can also be, I can also get referrals from outside providers. They might, occasionally I'll get a phone call from somebody, from one of the providers in the community. Their client is in here and they ask for me to check on them and see if they want to participate in any of the reentry services. Or sometimes it's kind of suggestive. I've even gotten phone calls from attorneys asking if I would work with an individual, maybe put together a plan or something like that. I also work closely. I might jump around a little bit, so just a little bit nervous, trying not to show it. Let me read the last part of it. People must be within 90 days of a scheduled release to be eligible for the release planning. And for people who have a release date, that works out really well. But also there tends to be a lot of people, they don't have a release date, but they still want to be working and planning and things like that. And so I can usually track the time frame based on what kind of a court date they just had or something like that, because the tracking is usually the same. If they're coming up on omnibus or something like that, then I know that might be a time frame that there could be a negotiation for release or something. So I kind of try to mentally prepare for that, just in case they might suddenly be released. So the services that I provide are individualized court-ordered release plans. For the court-ordered release plans, usually I work with Mr. Ziegler, who's the counselor for the Office of Assigned Counsel. Usually he works on them, but sometimes his caseload is pretty big, so I might be asked to work on those also. But I'm always available to work on individualized release plans to help people get connected to services, resources, things that they would like to get connected to out in the community. Let's see. Oh, I'm trying to read.
Assistance with the mental health sentencing alternative.
The mental health sentencing alternative, yes, that's a lot of times I like to help people with those. They're not usually sure what it's about or how to prepare for their interview. So usually I just like to sit with them and try to help them organize things. You know, it's basically just a regular release plan. But the mental health sentencing alternative, people that come in and interview to see if someone qualifies for that, they like to know that they have a plan, they're organized, they know what they want to do step by step, and the steps they're going to take and when they're going to take them and things like that. And that usually helps them get into that diversion, and then they can be released.
I think with that one is really unique. It just kind of started happening within the last couple of years. It was a new, I don't know if it was a new bill that was passed, but what's different about the mental health sentencing alternative is that it comes through Department of Corrections as opposed to our local courts. And so there's a little bit of a higher need for individuals to follow through with those plans. And that's why it's helpful to have Kenna here, because once those people are released, they are required in a very short period of time to start complying with those DOC requirements through the mental health sentencing alternative. And if not, the alternative then is for them to spend some time in prison.
Yeah.
So Kenna being able to help assist those individuals helps to make them set up for success and less likelihood of being able to have to go to prison.
Yeah. it's a little bit more intense than just checking in with DOC like they might think. And so also I like to, so here, let me just take you through the process. So I might get a request via from the kite. Usually it's from the kite, or maybe it's when I'm down in the dorms. I visit each dorm once a week, and somebody comes in, they want to know what reentry is about. And so I share with them that I do my best to provide information about community resources that they can use that might help them find work, find a place to live, food, clothing, all the things that they might need. And that I'm also available to really nail it down. If you really want to do something different, then we can sit down, we can talk about, you know, those specific needs, and we can get down to more specific providers for different things. And I also, I'm available to help put in a referral for a substance assessment for those that want to get assessed. Maybe there's time for them to go to treatment while they're here. Sometimes that can happen too. And that's, once I bring the assessor in, they do the assessment, and then they work with the attorneys on everything after that. Let's see what else. Also, I also facilitate life skills classes, and somebody can participate in that. We usually the topics are, you know, core skills like communication skills, managing emotions, anger triggers. It's a journal-based program, so it really opens up the door for a lot of self-reflection. And you know, the people that write this material, they say all change is self-change, and I really agree with that, because nobody can make me do anything if I don't feel like I need to do it, or if I want to do it. So journaling and through these topics and stuff really kind of opens up self-reflection. And there's some really, really great conversations that come out of the groups, and a lot of aha moments, which is amazing, because those are the things that's going to trigger change in a person when they have an aha moment and they realize, oh my gosh, maybe I do need to take a look at this a little bit. Those are always really awesome. And let's see, am I leaving something out? I'm always leaving this here.
Yeah. Well, I think to just add a little bit more about those reentry groups that Kenna had mentioned briefly earlier, what's excellent about the weekly reentry groups is that, you know, it might be hard to capture everybody coming into custody because Kenna is clearly just one person and this is a big facility. So in order to capture a bigger audience, anybody who is interested in maybe learning about reentry services, what reentry means, get connected to Kenna. She is in each dorm every week, and it's an open group, so anybody can attend, and it kind of helps us be able to reach a bigger audience, so that way anybody can really have access to reentry planning if they like.
Yeah. I've also put together some flyers and some resource materials that I send back down to the dorms after I meet with them. If they want a resource packet, then I'd be happy to give it to them too. But also housing is a big topic, and I know when I first sat in this chair, I was a little confused as to how is the housing handled in this area. And so I did some research, and then I typed up a paper that I put in this resource packet, and it breaks down the different pathways to housing. It starts with the Thurston County Housing Authority, coordinated entry, the HEN program, transitional housing, specialty courts. It kind of lays it all out. It's got their contact information, and a little blurb about, you know, what it is that they do. And I encourage people to apply for everything that you qualify for. And then I give them the reality of how challenging housing is. And it is important to apply for everything you possibly can. It's also important to follow through and always make sure your contact information is up to date and stuff. So I kind of go out there in my mind, you know, on the street with them and remind them, yeah, it's challenging to remember to follow up, but it's really, really important. Nobody has the extra people to go out and find someone when their turn comes up for, excuse me, for housing. So there's another resource that I really want to talk about that I have found to be really, really helpful. And that is the jail transition teams from the medicated providers. So I've had let's see now, that is WellPoint, Molina, and United Healthcare reached out to me and they asked if I would provide their letter of information when they learn that their people has come into jail. And so they get a report when they learn that a client is incarcerated, and they send me their names, and I'm able to print out this letter of information and get it to the individual. And if the individual wants to learn more about what they can help with, then they will come and visit the people. And the amazing thing is I didn't realize it existed, but they have a jail transitions team, meaning where I end at the door, they can continue to work with an individual to help them get connected to their medications, primary care, and even help point them in the direction of where to apply for housing, employment, and things like that. So they kind of help bridge the gap a little bit from this door to where they're going out there. So, and that's a real important thing that's been working out well.
Yeah. Some other things our reentry program does is work within the community. Our reentry program facilitates quarterly Thurston County reentry service provider meetings to help connect community providers and make them aware of services available to their clients. This is shown to be beneficial in helping community partners be aware of gaps in services, as well as new services being provided to help fill gaps and address barriers to successful release. In those meetings, Kenna and I provide every quarter. We typically have somebody come in and present about the types of services that they may provide to our jail population. We recently had Molina come, like Kenna was just talking about, to discuss their role in their jail transitions team. And it was really helpful because a lot of providers in the community weren't aware that the insurance companies were providing this as a service. And so they were really, really grateful to hear that there might be somebody who's able to help bridge the gap, because many people aren't necessarily aware when somebody comes into custody, their insurance gets put on hold, and so they don't have access to that. And it can take some time for it to be restarted after they get released, which means that it hinders their ability to get involved in treatment, to receive any sort of service for their behavioral or mental health or substance use needs. So being able to connect with these jail transitions teams helps bridge that gap to help get them enrolled in services quicker. And then Kenna, I don't know if you want to talk about some of the challenges that you've experienced, and then what are some of the things that we're doing to find solutions?
Yeah. Some of the challenges are, well, first of all, getting buy-in from the individual. That can be a challenge. And I've found that it seems like maybe they aren't used to people in the community actually being interested in helping them. It has nothing to do with you have to do this or blah, blah, blah. It has nothing to do with any kind of consequence or what someone else's expectations or anything like that. And I think it's refreshing for people to hear that there's a lot of community providers that simply want to help somebody who's coming out of jail and maybe lost everything, confused, not sure where to go. There's a lot of peer-based services. There's surprisingly a lot of options in the community, and there's no expectations. And so if a person is here long enough, they tend to come to the reentry group like weekly. It really isn't a class. We cover the same information, same topics, maybe something a little different. But I think I think it's interesting when I see people repeatedly in the reentry groups, and that means that they're thinking about something. And so I do my best to help them with information, but I also encourage them to come to the life skills group too, because maybe there's some more things that they want to talk about. Other challenges for me that I've seen is the transportation from this door to maybe the door of their first appointment after they get out. I'm a person with lived experience, and so I understand the struggle from getting out of jail and feeling that freedom, taking a big deep breath, and as I'm exhaling, I've got my addiction yelling at me like this, and I have responsibilities yelling at me like this, and it instantly is overwhelming, and I haven't even left the parking lot. So you know, a transportation from one point to another, or some way to be supportive and encouraging to help the individual go from this threshold to even their very first appointment. So different things we're doing to find solutions is, you know, being active in the community, being part of the, you know, the reentry meeting that we do quarterly. Also, there's other committees that I participate in the community, and just kind of talking with other providers in the community and kind of getting a whole bunch of people's ideas and seeing what we can come up with. And another way that I do also is to provide us with information, real information, about things in the community. I don't say, oh yeah, there's lots of housing and blah, blah, blah. Go here and you can get funded and you can get a place to live. I'm real about it. I give them the resources. I give them the hotline number. I tell them that housing is challenging and it's going to take perseverance and it's going to take dedication, and it might take time. It might not, but it's that they're worth it. So it's important to keep putting one foot in front of the other.
I think, you know, part of some of the things that individuals struggle with, like Kenna was saying, is not many programs in the community provide transportation. And so when people walk out the door, they're not quite sure where they need to go or what they need to do. And so in order to kind of alleviate some of that stress, Thurston County has what they've called the Resource Hub. It's located over at the court complex. And it's essentially a specific resource for individuals coming out of custody and coming back into the community. And so Kenna works pretty closely with the owner of that or the person in charge of that organization, giving them information about people that might be releasing. We also provide that information to inmates in custody. And it's kind of like a one-stop shop. And so if they're just kind of curious about getting a housing assessment to get on the coordinated entry list, if they're looking for substance use assessment or mental health assessment, they can go to the Resource Hub and they have somebody there different days of the week to be able to provide those services. So trying to kind of catch people who aren't quite sure where they want to go or what they want to do, we let them know that the Thurston County Resource Hub is a good place to kind of first start, maybe get a cup of coffee, a snack, and then be able to kind of connect with the services in the community. And then I think another thing that's really great, the relationship that we have with the jail. If we are aware of somebody who is going to be getting released and we have, you know, some concerns about when they might be getting released on certain rare instances, if we work with the jail, we are able to sometimes be able to coordinate a release time that's beneficial for the individual, so that way they can release from the jail and connect with somebody and then go directly to where they need to go. It's not always the case, but the jail has certainly been helpful in being able to help us facilitate some of those releases.
Mm-hmm.
And then ways that we support our correctional staff, working from within to meet the needs of the jail. So some of the benefits of working within the jail, our program, we are able to assist deputies by providing crisis support 7 days a week. We're able to respond quickly since we are here and on site. And then with that, also on-site consultation. I think our staff has developed a pretty good relationship with a lot of the jail staff. And so, you know, if If any of the deputies are encountering any sort of difficulties or struggles with an inmate in custody, they feel pretty comfortable about being able to either call us up on the phone or stop by our programs office, let them know, hey, we've got this person in the dorm. They seem to be, exhibiting certain kinds of difficulties. Would you mind checking in with them? Or how would you, recommend working with this individual to help support them? We do care coordination. So again, deputies are more than welcome to stop by our office or call us up on the phone, ask us, is this person receiving referral for medications? This person is concerned about getting released. And we can quickly notify the correct staff to be able to follow up with that person to make sure that they're getting the support they need. We're able to help with quick releases. So that might look like an individual who's gone to court getting released, and maybe as the jail is preparing that person to get released, they noticed they were booked during the summertime. And so they came into custody with shorts and a t-shirt, and now they're getting released in the middle of the winter. And obviously the clothing they came in with is not necessarily appropriate. We've had staff contact our programs office and contact Kenna and say, hey, do you have anything in your clothing closet that can help get this person out the door so they're not left in like flip-flops and a t-shirt?
Yeah.
We also help referrals to the DCRs prior to release. So again, if the jail is releasing somebody and they know that somebody maybe had some difficulties while they were in custody, they call us up, let us know this person's about to leave. Do you mind meeting with them, or do you think that this person maybe needs to be evaluated by a DCR? And then we can either touch base with that person really quickly to kind of provide an assessment, or we can review the notes and our history with that person and say, yeah, we should probably have a DCR check with them before they leave. And then again, the Western State Liaison for Competency and Restoration, and then also placing items at individuals' property. Since we're here, we can follow up really quickly, being able to run that up to our intake area and be able to put stuff in people's property.
One of the huge benefits of having mental health in the facility and working collaboratively with them has also been, we have some people with some mental health issues who have been part of the competency process. They may have been restored, returned, gone off of their meds, and sometimes those individuals need a level of care that we're just not capable of providing. And so working with the mental health staff, Alex and her staff are able to request an expedited process to get them back to Western State Hospital, so they're not languishing in the jail in that condition.
Mm-hmm. Yeah. So walking through the process, deputies can and often refer as soon as somebody is booked into the facility. So that might look like somebody coming into custody who is heavily intoxicated, or maybe they're coming in and exhibiting some mental health symptoms. Deputies can contact us right away to get them looked at. Usually that's an MHP who conducts a brief assessment determining needs. And from there, they can either be referred to another program, or at any point in time while somebody's in custody, they can refer themselves to any of our programs. Oftentimes, if somebody's not in crisis or seeking behavioral health support, we may refer them to our peer support program to kind of just to help assist them while they're here in custody. And then those who are within 90 days of release are referred to reentry for release planning. That's not to say that they can't work with reentry prior to their release. It's just beneficial to work with somebody on a release plan within 90 days of release, because with those dates, we can really help secure, appointments for individuals, or really kind of help them prepare for when they're going to be leaving. And some of those referrals that we receive, we've kind of talked about already, but that might come in the form of calls to de-escalate individuals in crisis, referrals for medication, asking us to see somebody because they have concerns regarding housing, or because of their behavioral health, or just behavior in general. We tend to do a lot of grief sessions for individuals who learn about somebody who's passed away on the outside, support with dealing with life incarcerated, requests for recovery meetings and support programs in the community, assistance with reentry planning, requests for clothing and hygiene items, concerns about safety upon release, and then support with the court-ordered release plans. And then I think that that's pretty much the exhaustive list. I'm sure that there's some things that we forgot, but more or less, That's kind of the services that we provide, the work we do with the Thurston County Jail and their deputies. And I guess if anybody has any questions, now's the time.
Oh, can't hear you.
All right. Well, thank you. That was excellent. Are there any questions out there? I know I have a couple. Okay, I'll ask mine. You mentioned that the services that are provided are voluntary. So when somebody is booked into the jail, how are they made aware of the services that are available? And when's the first time that you're able to meet with somebody once they're admitted to the jail?
I mean, it could be during the booking process, or, you know, the jail might get a call for somebody who's been arrested and is being brought into the facility, and maybe the arresting officers has contacted the jail saying, hey, we've got one coming into custody who's exhibiting some mental health concerns. Just giving you the heads up. And then usually the deputies located at the intake area will contact mental health and say, we've got somebody coming in. The arresting officers expressed that there might be, you know, some behavioral concerns, mental health concerns, especially those that may be indicated during the course of the arrest that they may be suicidal. We can meet with those people more often, notified as soon as they come in through the doors. The deputies and the jail also have a pretty extensive screening intake. And in that screening, they'll ask questions regarding mental health. And if any of the individual indicates that they've experienced any of those criteria, the jail will notify us. They'll put in a referral for us to meet with them. So it can happen pretty quickly.
Okay. And so, so somebody's been identified, they've been marked as somebody that needs some assistance. And so you go and chat with them and they decide, no, I don't want your help. I don't need your help. Go away. I mean, is that the last of it? Or do you do motivational interviewing? Do you check in on them again and try to convince them that this is the best thing for them? What does that look like?
We'll let them know, you know, hey, mental health are here 7 days a week. We respect that you know, aren't necessarily needing services at this time. If that changes at any point in time, these are the ways that you can contact mental health. And so we'll let them know. They can fill out a paper kite. They can send an electronic kite. They can notify the deputies that they'd like to speak to mental health. We often let them know if it's a more urgent request, you know, say that they're really kind of experiencing some self-harm or suicidal ideations. We ask them to notify a deputy immediately, and the deputies will contact us if we're here in the building.
Excellent.
But so we do let them know that they can refer to us at any point in time. And depending on the level of risk that this person may have, we may prompt a follow-up and make another attempt to meet with that individual, maybe within the next couple of days or so, just so that they know that we're there and we're thinking of them and that we want to make sure that they're doing okay.
Excellent. Lieutenant Becker, you've been at the jail for a number of years. Were you there? I mean, has it always been that there's been this collaboration between behavioral health and the jail all working together in the same facility? Has that always been that way since you've been there?
No. So long story short, no. When I first started, we had 1 or 2 mental health staff, mental health professionals on that would come. They weren't here 7 days a week. So we were forced to kind of triage and put the most critical people up first to be seen. And oftentimes that meant the people who were maybe less critical were never seen or didn't really receive those services. At the same time, our mental health staff have expanded. The number of people with mental health issues who come into the facility has exploded. So the collaboration that is going on with OHRS is probably the best I've seen in my entire career, to be honest with you. The programs all work together very seamlessly. The same people are attending different meetings. She mentioned coming to the classification meeting. That's huge. We have people who, you know, our goal is never to keep someone in isolation, but if they're posing a risk to others, we work collaboratively with mental health to try to come up with a plan to get them. Ultimately, the decision's theirs, but we always can present them with a plan and opportunities to slowly transition them to be around others, and to see the psych provider, maybe get on some medications. And so that weekly check-in, oftentimes mental health will go check in with those people repeatedly just to see if we can get them to move in that right direction. So the level of collaboration, I think, is been huge in addressing our huge mental health population that we have. And we have record number of people at Western State Hospital. It used to be, you know, if we had a few people up there, it was something. And more recently, I think we had 32 people at one time at Western State Hospital in the restoration process.
Yeah, and that's great that the waiting times aren't as long as they used to be, that we're getting them in pretty quickly. So that's good. Excellent.
And I'll say that having the mental health here and their ability to see people more often has assisted with us getting people to Western State. They're gathering the reports, and when there aren't reports being written, you know, Alex can reach out to me and say, hey, I'm hearing this from staff, but nobody's really documented these things, and I don't have the ability to show to Western State what issues the person is experiencing. And so that collaborative effort, then I can go back to staff and say, hey, you need to be documenting this. People need to see it on paper what's going on. So those are kind of the behind the scenes collaborations that make a huge difference.
Excellent. Yeah, that's something I noticed when I visited all the jails that had that collaboration with their behavioral health, mental health, and medical seem to be a lot more efficient in the work that they're doing with the population. So you guys are setting standards across the state. So keep up the good work. Thanks, everybody. Take care and be safe out there.